Lizzie Nolan. I'm the Vice President of Double Helix, and we're here with Dr. Jeff Unger and Meet Advisors, who we'd like to do a nice thank you to, interviewing about our chronic disease series. Today we're going to focus on diabetes management, and first of all, we'd just like to welcome Dr. Unger. Thanks, you're here all the way from California today.
Well, actually, Lizzie, I grew up in Chicago. It's nice to be back on a cold, wet, windy day, just like I imagined it 30 years ago.
Well, welcome back.
Nothing's changed. Thank you.
That's great. So like I said, I'm the Vice President of Double Helix. We are a health and IT company. We help patients and doctors see one another conveniently online. And Dr. Unger is one of our very esteemed advisors. So we're very happy to have you here today and talk about diabetes because you're a diabetologist. Can you explain to us what the difference between a diabetologist and an endocrinologist is?
Yeah, well, first of all, I'm actually a family practitioner. They're board certified in family practice. There is no board certification in diabetology, but diabetologists are clinicians that have a significant interest in managing patients with diabetes, either type 1 or type 2 diabetes, Lizzie. So if we feel that we can do this and we can do it expertly, then we could designate ourselves as being diabetologists.
That's great. So how many of your patients have diabetes? If a percentage?
Yeah, so I see all different types of patients. I don't see kids, but of those patients that are 16 years and older, I would say that 80% of my patients have diabetes. But you very rarely get a patient with only diabetes alone. So we see patients that have diabetes and hypertension, diabetes and high cholesterol, diabetes and osteoporosis, diabetes and depression. We even see diabetes and heroin addiction. Wow. So being a family doctor, we can handle all these things, which makes it kind of fun. And alluding to what you had said before about endocrinologists, there's different types of endocrinologists. Some deal with thyroid problems, some deal with adrenal problems, but diabetologists are separate. They only deal with diabetes, and that's it.
Okay. So of the patients that you're working with, what do you think is one of the most difficult things for them in managing their diabetes? Or what are, the kind of questions that are coming to you every day?
Yeah, so that's one of the most fun things that I actually do, because after seeing a new patient with diabetes, and by the way, when you have diabetes, you're scared to death. You come in to see a doctor, new doctor, and you're just shaking the whole time. So my favorite question after seeing these patients for an hour is, what scares you the most about having diabetes? And their answer is, I don't want to lose a leg. I don't want to lose an eye. I want to see my grandkids grow up. And I tell them point blank, you're not going to lose a leg, you're not going to lose an eye, not on my watch. And I think the most difficult thing for people to understand with diabetes is that we do have successful therapies and that they will be okay. I know this for a fact. I actually have diabetes myself. And I'm not going to ask them to do anything that I don't do myself. It's going to take a partnership, and it's going to be fun. It's going to help them become healthier, and they're going to learn a lot. In fact, I find it fascinating that my patients could, if I go on vacation or if I come to Chicago to see you, Lizzie, then my patients can become actually the smartest people on the block in regards to diabetes care in my neighborhood. They are really, really good at this. But they have decided to manage their own diabetes with the best education that they can possibly muster.
That's great. I think that educating patients is a lot of what we try to do in our ventures together as well. In terms of education, is it an issue of access to resources, or is it an issue of having the time to really delve into that kind of education? Where are people hitting these roadblocks in self-management of diabetes specifically?
Well, that's a great question. Family doctors, on average, and I think you know this, we are given about 8 minutes per session to visit a patient.
Right.
And there's no way you can deal with a chronic disease state like diabetes in 8 minutes. In fact, if you do that, then the patient will lose a leg and
Right.
will lose an eye. So it takes about 40 minutes per visit in order to make them better and make them a part of their own diabetes self-management. So it's a partnership, and this takes time, and this becomes frustrating sometimes. So I think what you guys are doing, what your team is doing, is providing us with the tools and the opportunity to expand these visits beyond just what we normally see in our office, and reach out to patients in a way that I don't think really exists right now using certain types of technology.
Absolutely, and that's a great segue to my next question is, what do patients come to you asking for technology solutions in their diabetes management or their general care plans? Do you see a really a big need for a technology solution in your everyday work with diabetic patients?
I don't think patients really know what's out there. However, when we talk to patients, because I know doing a lot of research, clinical trials, I know what's coming up down the road. I know about the artificial pancreas. I know about in a few years we won't have to do we won't have to do blood glucose testing on the fingers anymore.
Right.
I know what's out there. And when I talk to patients about this, they're thrilled to death about what they're going to be able to do in regards to diabetes management in the next 2 to 5 years. But when I talk to them about this, they will do anything that we ask them to do.
Right.
If I bring in technology about this, they'll be more than happy to do this. Whatever it takes to get them better, as long as they are involved with their care. It'd be different if I just say, okay, Lizzie, well, you got diabetes, not doing so well here, take this medicine.
Right.
We need to have them part of their management, and not only them, but their wives, significant others, kids, everybody. The more they learn, the better it is for them.
Well, right, because a lot of these diseases we're talking about, I mean, generally chronic illnesses, but diabetes, their lifestyle, they affect, not only are they lifestyle diseases, but they affect your lifestyle as well. So is getting the family involved, would you say, one of the most crucial parts of dealing with diabetic patients?
Yeah, I always tell my patients with diabetes, I can't cure this disease. There's nothing I can do to cure it.
Right.
And for our really obese patients, we can cure it with metabolic surgery, Lizzie, but for the most part, I can't. As a doctor, I feel bad. I can't cure anything except if you come in with gonorrhea, shot of penicillin,
right.
We're best friends.
Right.
But other than that, I can't. I can manage things. And
right.
with diabetes, what we're going to do is we're going to set up a management team that's going to go through your lifetime. Diabetes is a progressive chronic disease that doesn't go away. So our best chance here is to get this in check early on and maintain that through the lifetime. And if we do this rapidly and ambitiously, you're going to be just fine.
That's great. Well, so now there's a lot of changes going on in healthcare, right? Everyone's pretty well aware. How is that affecting your day-to-day in the office, especially with your diabetes patients? How is the the ACA, and generally the healthcare, I would say, mix-up that's going on right now, or shuffling that's happening right now? How's that affecting your day-to-day in the office?
Yeah, I won't get into all the politics
Sure.
of the ACA because I've already written quite a bit about this. Let me just say that I am against all government interference in healthcare. And that being said, since the government has interfered, the price of medicine has gone up. Mm-hmm. Access to care has gone down. So now doctors are looking for ways to improve access to care, especially in chronic diseases. Mm-hmm. There is no doubt that the government cannot take care of patients with long-term chronic diseases. It really requires an entrepreneurial relationship between doctors and their patients. And again, whatever we can do to improve this relationship, we need to do this. But government needs to stay out of our lives and the lives of our patients so that we can make inroads, not only through technology, but also research and development. It's very important.
Yeah, absolutely. To have the freedom to be able to do that sort of research, in an ethical and in an outcomes-based way, right?
Yes, absolutely.
So my final question for you is, with all the changes that are going on right now and patients really needing to be more a part of their care, how do you see technology filling a role in helping patients be more self-managers or even, champions of their own health plans?
You guys at Double Helix have come up with some new technologies that are really forthright in helping patients manage chronic diseases, not just diabetes, but obesity, hypertension as well. It's very simple. I can barely turn on a computer, Lizzie. You know this. I mean, you carried my computer in this room here, and you turned it on for me. But we need to have something simple that primary care doctors can use, things that are easily integrated with EMR, and things that help us identify where our deficiencies are. Not so much what the government tells us to do, mm-hmm. but what we can use to integrate our own personal knowledge of patient care into what's best for our patient. And I think that this technique, these technologies that you have and you've developed are really critical for helping all of our patients. We've got right now 92 million Americans that have some type of diabetes, whether it's diagnosed or undiagnosed. That is costing us a ton of money, $170 billion a year. Just to put this in perspective, that's how much money I lost last week at Caesar's Palace. So, but I got even. I stole 600 sweet loaves. That's a ton of money.
Right.
And we need to do something about that. So we can help by using new technologies, getting patients involved with their care, making this treatment exciting for the patients. Diabetes is not real exciting, but if they can get more involved with their care through technology, I'm all for it.
Right, absolutely. Great. Well, thank you so much for being here. We really appreciate it. Thank you for watching. And again, thank you to Meet Advisors for having Dr. Jeff Unger from Unger Primary Care in California and me, Lizzie Nolan from Double Helix Group. And we'll see you at our next show.